Hi, everybody. We are excited to speak to you about home health device for remote care coordination. My name is Neela, and my teammates are Sarah, Ferris, Jeannie, and David. We can move on to the next slide. In 2015, the United States spent $3.2 trillion on healthcare, accounting for 17.8% of the GDP. And we expect that number to rise to 20% by 2025. The World Health Care Organization ranked the U.S. healthcare system 37th among its 191 member countries. Higher healthcare spending in the United States has not translated into improved access to care or outcomes. 86% of healthcare expenditures are for treatment of chronic diseases, including hypertension, diabetes, and heart disease, to name a few. Healthcare needs of the growing and aging population are expected to rise 17% by 2025. Move on to the next slide. Our current system is neither effective nor financially sustainable. There are several drivers, including rising healthcare costs, increased demand associated with epidemiologic shift in our population, inadequate supply of healthcare providers, and poor outcomes on health metrics. Next slide. We currently have a fragmented healthcare delivery model. Our model compensates for fee-for-service and not for outcomes or quality. And care coordination is a challenge. In the middle, you can see the patient. And as you can tell, there are many checkpoints, multiple transitions, silos of information, and unclear accountability. Next slide. Care coordination can organize patient activities, specifically care activities, and deliver efficient services. It has the ability to manage chronic conditions, and research has shown that it can improve outcomes and reduce costs. Next slide. Remote patient monitoring is a method of healthcare delivery that uses the latest advances in information technology to gather patient data outside of traditional healthcare settings. RPM uses digital technology to securely collect and transmit health data from patients to healthcare providers in different locations. David, can you play the video?
Mrs. Lee was recently discharged from the hospital. Her doctor ordered remote patient monitoring equipment to be delivered so Mrs. Lee can track her vitals at home. She's been on the program for about a week and a half when the remote monitoring nurse notices that Mrs. Lee gained 5 pounds in 2 days. She calls Mrs. Lee to ask about this weight gain and finds that Mrs. Lee has questions regarding the dosage of her prescribed diuretic medication. The nurse explains Mrs. Lee's medications and diet protocol. With her new understanding, Mrs. Lee's weight quickly returns to an acceptable range. Mrs. Lee's participation in the remote monitoring program has assisted her in avoiding a clinic visit and potential ED visit. Remote patient monitoring provides monitoring and support at home to help patients reach their healthcare goals.
Okay, I'm going to pass it over to Jeannie.
Thank you so much, Neela. Wonderful job introducing everyone to remote patient monitoring. So when we observe our market size for this product, we note our total addressable market, or the total possible demand for our product, to be amongst 129 million of US civilians who are non-institutionalized adults and who have at least one of 10 chronic conditions. As far as the US market size is concerned, we found 296.5 million of these US citizens were receiving this product in 2019. And then from a global perspective, $956.46 million worth of this product were seen in 2020. As far as our serviceable, addressable market is concerned, we narrow that down a bit more to those individuals, US civilians, specifically non-institutionalized, who had multiple chronic conditions, more than 2. And that number equated to 68 million. And those were amongst, even more specifically, non-Hispanic white adults 65 years of age or older. Now, of course, we cannot unfortunately monopolize the market. And so obviously other competitors exist, including Philips Healthcare, Honeywell, among others. We found that the cost for their devices amongst our competitors was there was a bit of a wide range, anywhere from 150 to 500 US dollars. And I'm going to now pass things over to Sarah to discuss market segmentation.
Thank you, Jeannie. To describe the market segmentation for remote patient monitoring, our group chose to divide RPM into two categories: disease types and solutions, as well as demographics. Chronic conditions that can easily be addressed through this innovative way of health management include cardiovascular diseases, diabetes management, sleep disorders, and cancer. RPM solves these conditions by researching, developing, and distributing resources related to monitoring devices throughout the world. The demographics, both globally and nationwide, include primary focus on the elderly, but highlighting polypharmacy, or the use of multiple drugs to treat conditions, compliance and confidentiality through the access of care, as well as teaching users ease through the technological services being offered by remote patient monitoring. We'll go ahead and go on to the next slide. There are various stakeholders involved in the development of RPM, starting out with AT&T Business, who has started to host business sessions related to RPM during COVID-19 to let mobile users know how to exactly engage in confidential use of health data. Global Health, a data analytics and consulting company heavily involved in the home health device industry, is also a major stakeholder. Telehealth, or Vital Tech, develops RPM tools for further research, data collection, and continues to work on enhancing the quality of life for selected demographic of seniors through connected care services. Patients and providers adopt integrated data from devices to interpret diagnosis for patients and their caretakers, as well as work to learn the intricate details of technology use. Connected Health Conference, recently developed in 2019, gathers leaders and stakeholders from all around the world to discuss how to overcome barriers to the deployment of RPM. And lastly, Fitbit, Apple Watch, apps, phone devices are all include having wearable heart monitors, as well as Bluetooth-enabled scales. They also include glucose monitors, skin patches, shoes, belt, or maternity care trackers. These non-invasive devices acquire, transmit, process, and store health patient data. Now I'll pass it over to David to cover non-market forces.
So of course, thank you, Sarah. Of course, adaptation of the RPM will require analysis on the non-market forces, namely financing, structure, public policy, consumers, technology, and accountability. And for example, the pricing structure and reimbursement definitely had to be taken into consideration, and also how to finance the upfront cost for such an infrastructure and services. Also, there are multiple vendors, as Sarah mentioned, in this space, that how they operate among themselves will be very important, especially for sharing information and facilitate patient care. From a public policy perspective, the licensure body for each state will have to come up with measures and agreement regarding especially telemedicine, telehealth, how the providers can provide services to patients in another state and another jurisdiction. And also when it comes to medical legal claims, how such liability can be accounted for. From a consumer's perspective, acceptance will be very important. It comes down to user habit, how to use technology. And of course, there is always a concern about privacy and security of storing personal data online. And ultimately it comes down to also consumers' compliance with their management plan. So again, we consider this RPM market to be a very large market. Globally, it's been estimated to be $956.46 million in the year 2020 for the RPM equipment, and it's also expected to have a very high growth rate with a CAGR of 19.7% from 2021 to 2028. So for the future, RPM is definitely here to stay. There are many drivers for this technology, and they'll continue to evolve and continue to push for this market. Of course, there are barriers, but innovators, providers, and the vendors, we continue to overcome the barriers. The ongoing COVID pandemic is also further highlighting the importance to move in this direction. And it's more than just the outpatient telemedicine visit that has become a headline of the news, but COVID also highlighted the importance to try to avoid overcrowding the patient visit, patient room. So the inpatient monitoring is also becoming a very important application for RPM. Now pass back to Jeannie.
Thanks so much, David. Yes, so remote patient monitoring is definitely thriving on the emergence of new innovations, and it's going to continue to expand over time. We find that from the arising crisis, which includes, like David spoke about, COVID-19 and market demographics as well, which people are going to continue to age. Those with chronic conditions will obviously continue to need to very much so need help, and to need help from a telehealth perspective to mitigate the dangers of them being exposed in ERs, urgent cares, etc. So this is obviously something very cost effective and very much helpful towards specific market demographics. And we find that it's going to be something that sticks around for a long time. It is the future.